doctors how to use this equipment in their practice. So, focus is on decreasing recovery time by using BEMER. So, a lot of times with accidents or sports injuries, there's a long recovery and versus two. And so we want to get that time down and get everybody back to work, right?
Absolutely.
So, thank you so much, Doc. Great to have you.
Thank you. Sorry for the noise. They want to keep us to 15 minutes, and I can talk forever about all this. And so if I have notes, at least the attempt is to stay within that guideline. But before I begin, I'm actually, with the lighting and everything, I'm going to take my hat off here with respect to y'all. I want you all to see this beautiful face. I've been told it's a beautiful face. I was standing in front of the mirror when I heard it, but I heard it. So, give me just 1 second. I'm going to just hang that here. So, excuse me. As it was said, I am in sports medicine. I started in pediatrics, and that evolved into sports medicine. I've been doing that for over 25 years. The way that I describe what I do is I work with pro and elite athletes, keep them in the game until they're ready to leave on their own terms. Okay. So, BEMER is a large part of the therapy protocols that I utilize to help them get back to play as quickly as possible, as well as, excuse me, as well as helping them with their performance to help them perform and play even better. Now, I was introduced to BEMER back in, I think it was 2016, by an independent BEMER distributor. He told me this was something that I needed for my office, and as he went and described and talked about it, I'll be honest with you, I thought it was too good to be true. I mean, a machine that does all this stuff with all these different parts of the body, I'm used to having stem machines or ultrasound machines that focus in on just one part of the body. But this, he said, would work on all parts. And so, what I ended up doing was I researched it. Now, when I say I researched it, I don't mean I looked at Google reviews or what Yelp was saying about it. I actually went to a website called pubmed.gov. pubmed.gov. It is a government website where clinical studies are posted for other doctors to see. Now, these studies are peer-reviewed. In other words, you are able to know for a fact that they've been checked and balances. So it's not one of these opinion type of papers being posted. Like, what is the best headache medicine? Sponsored by Tylenol. It's not like that. So I actually spent a year and a half researching to find out more and more about this amazing device. My research then showed me that it is, I wrote this down because sometimes I get tongue-tied with this. It's a multi-biological system medical device. In other words, it works on all systems of the body. You have the reproductive system, you have the nervous system, you have the muscular system, the skeletal system. As Dr. King and Dr. Meyer were talking earlier, circulation goes through all of those. And the BEMER is the delivery of bringing better circulation to the cells. That's why it's able to cross over. And I'll be honest, if you guys want to know more about that, during our Q&A, feel free to ask some questions because I have more in-depth stuff that we can talk about it. But again, 15 minutes. So, but I was amazed to see what was going on. So in my practice, I decided to do my own clinical study. So we took our athlete patients that we had, we divided them up into thirds. 1/3 was a traditional approach that we always did, which had good results. Another third was with the BEMER, just BEMER only. And the other third was using the traditional plus BEMER together. We found that the results, after doing this for a while, all of the categories did very well. But the category with the BEMER and the traditional put together, where the BEMER helped deliver the blood and the benefits of the other therapies to the systems much more efficiently, there was a 50 to 55% greater improvement. Now, what ended up happening is word got out that we were being very successful. I was getting phone calls from training facilities for pro sports teams in Texas and California and New York doctors were calling us. They heard about it, but they didn't understand how it worked. And they felt we had that opportunity to share with them, and we were happy to do it. I even got a phone call one time. Well, actually, it wasn't a phone call, it was an email, and dealing the same way. And the person said that if they flew in to town, would I be willing to take time to fix them and work on them? I was like, sure. You know, if you fly in, if you make that effort, we'll do what we can with our schedules. I said, where are you coming in from? She said, New Zealand. I said, like, New Zealand, New Zealand? I mean, you know, and she's like, yes. She was a downhill skier that had an injury with her knee that got repaired but wasn't healing properly. And their orthopedic surgeons were seeing what we were doing by what our athletes were posting online and told her, if you want to get better, go talk to him. She came in. I'll be honest, it's the furthest, you know, anyone's ever come. So, with our patients, we always want to introduce to them how the BEMER works. And so there's a process in which we do it. Sorry if my mouth gets dry. Thank you. So, we have a new patient come in with an injury. We'll do the examination on them to figure out what is going on. Why are they having this trouble? What is it that we need to do for treatment goals to get them back to play as quickly as possible? Once we've established that, then we want to introduce the BEMER as part of their first get them to understand the value. As Dr. King and Dr. Myers were talking earlier, you know, there's a system of circulation that comes from the heart all the way to the cells. So we explain that first to them, because a lot of people they know about the heart, they know about the arteries and the veins, but they don't understand there's capillaries that lead, or that microcirculation that lead directly to the cells. And that's where this unit is operating at most efficiently, is at that area. Almost like coming to the doorbell, or excuse me, to the door of your house and ringing the doorbell saying, hey, I'm here. You know, instead of just saying, like, I'm in the neighborhood. Quick, turn the lights off. You know. Some of you have done that. But, so we explain to them how the circulation works. The next thing that we talk about is, again, as was being explained earlier, is what is in the blood that makes it so important for that tissue repair. And so we go through the various things, such as some of the things that were said earlier with, like, the red blood cells helps with oxygen and protein. The white blood cells help fight inflammation and infection. The endorphins and enkephalons, how they help with pain management. Or even the stem cells help tissue repair. We want those getting to that area much more efficiently, and the BEMER assists with that. The last thing that we do is we talk about how the BEMER is different than other devices that they're used to seeing, such as ultrasound, in STEM, etc. How the pulse electromagnetic frequency that I was talking about earlier is very unique. There's more things I want to talk to you about, but again, 10 minutes. So if you have questions, please do the Q&A. There's more I expand. But one of the reasons why we also feel that our patients and athletes respond so well to this treatment being added to their regular protocols is that there's what they call a parasympathetic response in your body. Parasympathetic is that relaxation stage that comes that helps your body to calm and during your rest. Except what is interesting is that if you're not in a parasympathetic state, your body doesn't heal. Because there's trauma and turmoil that's inside the cells. So the BEMER has that unique frequency that is unique to that unit only that allows the body to reach that parasympathetic state. So that healing can also begin. Not just have that benefits of that circulation come to the cells, but have the body be in a state to receive what is coming to in the cells. So, again, more things that we can talk about that.